Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons, and Pius Group of Institution, Guwahati.
Hello and welcome to Notice Tonight, the show that decodes the region. With thousands of our people returning home to Assam and the rest of the Northeast, the number of COVID positive cases is shooting up. In Assam, the numbers may touch 1,000 in a few days. Even Sikkim and Nagaland have reported COVID positive cases after being free of the disease for so long. Led by Assam, the states in the region are enforcing strict quarantine measures, both institutional and at home. And that has been saving the day for us so far, because almost all of the new positive cases in Assam and elsewhere in the Northeast are people who are in quarantine after having returned home in the past few days. The question now is, with domestic air travel also resuming, the number of returnees will increase manifold. Can Assam and the other states enforce effective quarantine in the days ahead? Will our health infrastructure fail us in the coming days if the cases continue to soar? Can we stop people from returning home? If not, can the government think of increasing the quantum of cash assistance to try and facilitate our people from staying on wherever they are, particularly the workers? Well, to discuss the subject at a time when cases are increasing in Assam and the number of people having to be quarantined rising every passing day, and attack on trains that are carrying our people back to the Northeast, I am joined by Assam Director General of Police, Mr. Bhaskar Jyoti Mahanta, Principal Secretary Health, Assam Government, Mr. Samir Sinha. At the studios with me is Dr. Madhumita P. Das, Professor of Medicine at the Guwahati Medical College, and Dr. Nivedita Borthakur, a health policy expert who is Advisor, Policy and Innovation in the Assam Health Department. And from Guwahati, I am joined by political analyst Swapnanil Barwal. Ladies and gentlemen, welcome to Notice Tonight. But before we begin the discussions, let's go straight to Assam DGP Bhaskar Jyoti Mahanta joining me live. Mr. Bhaskar Jyoti Mahanta, welcome to Notice Tonight. Mr. Mahanta, I would quickly like to seek your views on two aspects. One, attack on trains that are carrying our people back home to the Northeast, to Assam and the other states in the Northeast. And secondly, issues relating to quarantining, people. Now, first thing first, Mr. Bhaskar Jyoti Mahanta, trains coming into the region are facing attacks in Uttar Pradesh and Bihar. This is adding to the difficulties in these times of crisis. Our people are in panic. There is a lot of anxiety back home. Are you in touch with your counterparts in these states? And has there been a government-to-government level talks as far as train security is concerned?
Absolutely. Our team, which is monitoring the movements of the trains and also taking up continuously with the Railway Authority, the RPF and the respective state governments, have been at it very actively right from the word go. Yes, there were some hiccups, there were some problems in a couple of trains, and these issues were immediately taken up with the respective state governments by our team and the RPF as well, and the problems were accordingly sorted out. And we are trying to ensure that such things do not happen. And our nodal officer for the movement of people, Sri GP Singh, and his very capable team, they are at it pretty actively.
All right. Now, can you assure the people of Assam that security on trains will not be an issue anymore, Mr. Bhaskar Jyoti Mahanta?
Yes, but there are always some unforeseen situations, the people, the passengers themselves will also have to be a little more pacified, because challenging times not only in Assam, it's everywhere. There will be a lot of pressure.
Right.
Therefore, we got to be careful. And but in terms of liaising with the respective state governments and also the railway security agencies, yes, we are leaving no stone unturned.
Okay, let me turn to other issues, Mr. Mahanta. You know, the number of people returning home is increasing with every passing day, and lots of them are testing positive. So, enforcing quarantine seems to be the key in preventing community spread. And in this, you know, a lot of people have been also sent for home quarantine, those who are tested negative after being initially put in the quarantine facilities. So the Assam police has a role there.
Absolutely. 138,000 people have already come back to Assam, and by different modes of travel, including air from yesterday onwards. So it's a pretty large number, and we are expecting more.
You see, now as a domestic air travel has also resumed, you are already saying that 138,000 people have already returned, and there is an Assam government estimate that there could be anything between 10 and 12 lakh people outside. So, you know, at least 10 more lakhs are supposed to return in the coming days. Now, the question that is uppermost in the minds of the people, Bhaskar, is that, you know, there may not be enough space for institutional quarantine, and if that happens, home quarantine will be the next best option. In such a scenario, do you think the role of the Assam police will be bigger, you know, in so far as monitoring those people who are sent to home quarantine so that they are at home actually?
Well, so far whatever has been done by Assam government is absolutely mind-blowing. The kind of focus, especially by the health department, in ensuring institutional quarantine and thereby not allowing the disease to spread to the community
Right.
is absolutely something that is very heartening. They are definitely so far saving the community in Assam. But then, yes, there are also the number of home quarantine people getting larger and larger every day. And Assam police has been tasked in respect of Guwahati city especially to enforce the home quarantine, and OCs of the police stations in Guwahati city have been made the incident commanders in respect of enforcing home quarantine.
Okay, OCs in Guwahati being made designated as incident commanders to look and effectively monitor those who are sent for home quarantine. Very interesting scenario. Now, Mr. Bhaskar City Mahanta, you know, do you have an estimate of how many people could be expected to return home? Or if I may put the question differently, you know, any estimate of the number of people from Assam working or studying outside, including those who got stranded? Of course, government leaders are saying that it could be anything between 10 and 12 lakhs.
We have some ideas, and we have done a lot of work out. There have been a whole lot of registrations done by the people willing to come back, and so we have a pretty near clear idea, and like we are trying to match up to the challenge that would be accordingly forthcoming.
Now, another thing that a lot of people ask, you know, have been sending, wanting to know, do you anticipate a situation when the authorities may have to either discourage or persuade those people outside not to come back, or at least not to come so soon?
Since it is not a police call, I will rather let the state government decide on this.
Okay, fair enough. Fair enough, Bhaskar. Finally, you know, as the state police chief, are you happy at the way people are going about adhering to the government guidelines on dealing with the pandemic?
Happiness has its limitations.
Yeah.
There are problems in the adherence to the guidelines in different sectors, especially the social distancing. The onus of ensuring social distancing is as per national directive of COVID-19 with that particular office or the shop or the organizations whichever initiates a particular activity. So now the police has been going around taking videograph of wherever these social distancing norms are being not followed, and we are not only taking action against the persons concerned, we are focusing our attention on the person who is to be held responsible, that is the owner of the shop, be it the head of the office or the organization whichever initiates that activity. So we are issuing notices to them. We have also requested deputy commissioners to close a whole lot of shops, and this has begun already. Accordingly, the adherence is now getting better. People are now getting a little more conscious and wearing masks. But as far as the quarantine people are concerned, we are a little worried. And for this, we have tied up with a particular NGO. And also we have been talking to the DRDO as well as a private farm to initiate geofencing, to ensure that the people in a quarantine in Guwahati city, home quarantine, they do not get out. If they do get out, we'll get an alert on our computer system. And also in addition, we are training a whole lot of volunteers who would be finding out the well-being of the person in home quarantine. We'll try and keep motivating them on telephones not to break the norms of the quarantine, and also we'll find out if they have any issue, be it physical or mental, or some administrative issues like lack of food, etc. So we'll try, our OCs will be up to the mark, and our IT team will be alerting the respective OCs, and then necessary assistance will be provided.
All right. So, lot of new lessons there for your force, the Assam Police.
Absolutely. We've been learning every day as we are working.
Okay, learning every day. Bhaskar Jyoti Mahanta, the DGP of Assam, thank you very much indeed for speaking to me on Northeast Tonight. Okay, I'm also been joined in the studios now by Mr. Samir Sinha, the Principal Secretary Health to the Government of Assam, a very busy man. Mr. Samir Sinha, welcome to Northeast Tonight. Now, a lot of we have been, basically talking about how the number of cases are rapidly increasing, Samir. It has, as we speak tonight, it is racing towards the 700 mark. It has crossed 600. It is racing towards the 700 mark. So, does that worry you? Because we all know about the preparedness of the Assam health authorities, but how are you looking at this emerging situation?
Yeah, in fact, not very long back in this studio, we were talking about very limited, number of cases in Assam. In fact, Assam got its first case on 31st of March, and and thereafter, once the road were opened and interstate movement was allowed, then subsequently the trains been coming. Since yesterday, the flights have resumed. A lot of people been coming, and in fact, one broad statistics that I would like to share with you. Barring a very few cases, in fact, almost all the cases have travel history. 99% of people who are positive today in the state of Assam, they have travel history. And this is important because people been coming from all parts of the country, mostly from red zone, southern states, western states, Maharashtra, a large number of people come in. And the only silver lining that I get to see is that because of our Honorable Health Minister's stated policy of ruthless quarantine with a human heart, this has paid definite dividend.
Ruthless quarantining with a human heart.
With a human heart.
Okay.
That is there is no negotiation on quarantine facility, and but at the same time we are there to provide all comfort, all basic comfort. Whether you are quarantined at home, you are part of the institutional quarantine, we are going to look after you. That we have been doing. So it's a that is what I'm saying, that because of this policy, when people mostly becoming positive, in fact, the test results coming from institutional quarantine, people are there. So the community at large, we have been able to kind of safeguard their health to that extent so far.
Okay. Now, I'll come back to you, Mr. Samir Sinha. Let me come to you, Dr. Nivedita Bhattakur. This question which I was posing to the DGP, and this, I think both Mr. Samir Sinha and you will be in a better position to perhaps comment on this. So a lot of people are now apprehensive about the fact that since people are coming in large numbers, now that the domestic airlines have also resumed operations. Now, what happens, suppose we exhaust the accommodation for quarantining facilities people? Of course, we also know that it will be rotating. People will be going out and coming in. But suppose what happens if the number of people who come in are so large that you exhaust all the facilities, then what happens? This is, of course, a speculative scenario. Have the policymakers been applying their mind to this?
I mean, Wasbir, there is no what if. It will... we will come to a point when we won't be able to cope if these are the numbers that are coming in. So I think Mr. Sinha will also agree with me that at some point we have to start living with COVID. And how do we do it in the best possible way? That is the next scenario I think the state and the country has to look at today. I mean, there is no escaping the fact that there will be a peak and then there will be a plateau and then hopefully there will be the curve will go down.
Okay.
Now, each individual will have to take responsibility. As Mr. Sinha rightfully said, people have been put in home quarantine. It is very strict quarantine, but with the human heart. So the state is providing all its support, all its might behind it. So people have to take their own responsibility. Our civic sense have to come so that people themselves take preventative action. Like our Honorable DGP said, people are roaming around with masks, people are not following the orders or the directives that are coming from the
Not
state.
all though.
Not all though. Some of them, most of them are keeping to
Yes.
social distancing and all. But you need just one or two people to start the chain. So we should all take our
Therefore,
responsibility.
everyone has a responsibility. Exactly. Now, Dr. Madhumita, basically, as Dr. Nivedita said, that we have to start living with COVID. How is coexistence easy? How is it? Because, initially, countries like the UK, they said that, okay, we will go for herd immunity. We are not going to be bothered. So that was the initial strategy. Of course, it later didn't work. So living with COVID, is it going to become a reality? Do you, as the medical fraternity, do you consider it as just another flu?
Yes, that has to be accepted, that there's going to be a time when we will have to learn to live with COVID. We've been saying that it's like living with HIV, it's like living with tuberculosis. When tuberculosis was first rampant in the world, people were put into asylums. They were not allowed to mix with other people in the society. When the Spanish flu came, it was similar kind of a situation. When influenza pandemic came 100 years back, it was similar. But we later learned to live with it. And now that we know the behavior of the virus and the extent of control that can be managed with social distancing, hand hygiene, and keeping away from the source, I think if we can implement that, if we make that a part of our life, there will come a time when we will all learn to live with COVID. Yes, herd immunity is something that we can think of, but that is going to be very difficult to achieve because a huge amount of people, more than 70%, will have to have the antibodies.
Okay. Now, let me go back to Mr. Samir Sinha. Everyone in the country is commending the preparedness of the Assam government as to how they have been able to deal with the situation. Very, very tough people, at the same time, very, very humane, right from the food being supplied to the people living in the quarantine as well as in the COVID wards and so on and so forth. So this has become a reality because in other states we have been seeing, not all, I'm not generalizing though, we have seen videos circulating of how people are languishing for either whether it is lack of treatment, whether it is poor food, whether it is just people not being bothered, but that is fortunately not the case in Assam. That is, let's not go into all of that. I'm just contextualizing the thing. But while doing this, you all must be extremely, worried as to how to keep things under control. And in this situation, the health minister, even yesterday as well as today, Dr. Himanta Biswa Sharma has said that things might come under control sooner than later. He has also given a date, 15th of June, 30th of June. These are the dates he is talking about. So what gives you this confidence that you will be able to take control of the spread?
There are 2-3 things that we are doing. As I told in the beginning, that our policy is quarantining everybody. In fact, the detailed guidelines and SOP been issued. And what we are doing additionally is that people who are released for home quarantine, we have launched a parallel program of surveillance at the district level. And this surveillance is as a very, very powerful tool. We, out of 26,000 revenue villages that we have here in the state, we have been able to cover nearly 90% of them so far. So, in fact, so that going forward, when people are released from the institutional quarantine for home quarantine, we can effectively do some kind of a surveillance, and every case is reported, and thereafter. In the meanwhile, what we have additionally started doing, that to start with, we only identified the medical colleges as COVID facilities, and apart from 1 or 2 hospitals like Sonapur Hospital and Mahendra Mohan Chaudhary Hospital, these are the 2 hospitals. So altogether 7-8 facilities were there in the beginning. But around 45 days or 50 days back, we started a very massive program where we involved the medical college fraternity. And people from medical colleges, they started going to the districts to train them, because we wanted to up these facilities also. So this surveillance, at the same time increasing the number of hospitals going forward, this will hold the key, and that has been the kind of strategy.
So, if I am not mistaken, what I have understood from what you have just said is that institutional quarantines are places where you can monitor everybody. Even now, what you are saying is that even people who have sent for home quarantine will be kept under strict surveillance.
Yes.
Not that, just because you put a stamp and you don't know what they're doing. So, it will not be the case anymore. Is that what you are saying?
Yes, stamping is just one method.
Yeah.
But
you will enforce.
Yes. Why we are, in fact, when home quarantine, when I say home quarantine, it is slightly different from what other states been doing. Home quarantine, in fact, we know that in majority of the cases, the toilet pooling may take place, and that could cause some contagion, some infection somewhere, because people may not have separate toilets unto themselves. So the kind of home quarantine that Assam follows is slightly different from other states. When we are quarantining a person at home, everybody who is part of the home, who is part of the family, everybody is quarantined. So the entire home is quarantined.
So they also cannot move about.
Yes.
They also cannot go out and roam around and meet family and friends.
Everybody who is part of the family, they cannot move out.
Okay.
During the entire period of that remaining period of home quarantine, could be 10 days, could be 11 days, 12 days, whatever, 14 days. So they are confined. And that is why the government is providing, when we talk about, when the Honorable Health Minister talks about human heart, he is talking about extending benefit and to these people also. So monetary benefits, either in cash or maybe in kind, it is being extended to such people also, so that they can fend for themselves, they can look after themselves.
Okay, even the families are being provided with an assistance to buy the essentials.
Essentials. We are doing.
Okay, now I'll have to go for a break, but very quickly before that, Dr. Nivedita Borthakur, you have heard the DGP, Mr. Bhaskar Janti Mahanta, talking about geofencing of people who are sent for home quarantine. Maybe I'll ask Mr. Samisena also to explain what that means. So, do you think use of technology can also go a long way in keeping track? Because what we are facing in Assam today, if we have been able to save the day for Assam, if we have been able to stop community spread, it is because all the cases which have emerged in the recent days are people from the quarantine centers. Mm-hmm. So quarantine is extremely important, whether it is home or institutional.
Absolutely. And I think geofencing is probably the right way to go, because ultimately we have a fixed number of manpower. Our manpower is not unlimited. And as the numbers increase and as we still want to go forward with the quarantine methods that Mrs. Sinha talked about and others talked about, we have to take help of technology to make sure that our the people who are in quarantine are tracked properly, are made sure that they are where they are supposed to be. So I think that's the only option that we have in some sense, along with, of course, supplementing with the human touch.
Right. Mr. Samir, would you like to elaborate on the geofencing now, or would you like to do it at some other time?
No, the basic idea is that home quarantine or institutional quarantine, whatever be the case, should not be jumped. Once you are part of home quarantine, once you are observing it, in fact, it should be there should not be any break and any jump. There are many states which are using lot of technologies that in case if you have an active mobile number, in the moment you go out of your house, probably you will get a signal that you have breached this home quarantine, and that should be dealt with rather.
So this technology are definitely being used in Assam as well. That's what you were saying, sooner than later.
In fact, yes. Going forward, we would like to use not only this technology, but other technologies also, which can help the government enforce home quarantine effectively.
All right. We'll go for a very quick break. Don't go away. We are at a very interesting stage of the discussion where experts on the panel are going to talk a lot about what Assam is doing to take control of COVID spread. And as we know, the Assam Health Minister, Dr. Himanta Biswa Sharma, has come up with a very significant statement, which is extremely positive in the last several weeks of rather gloom, if I may use the word. He is saying that Assam could well take control of the pandemic, or for that matter, the virus, in the next couple of weeks. On lot more coming up on the other side. Don't go away. Welcome back. Dr. Madhumita, you know, until a vaccine emerges, until the state authorities are able to take control of the situation, until the situation improves, you know, what are some of the things, what will be the state of affairs according to you? What is your prediction in the days ahead until the vaccine emerges, until we are able to take control of the spread?
With the very diligent and very active health minister leading us from front with Samir Sinha sir and his team, I'm sure we are going to control the pandemic. We are already in the path of doing it with the facilities for quarantine, with the facilities of tracking every single positive case till date. We have reached almost 600. I'm sure they have a track of every single patient. Having done that, I don't think that we are headed for a very dark or gloomy future.
So you are quite confident.
Yes.
You are quite confident of the situation. Now, Mr. Samir Sinha, you know, this question I was asking the DGP and others in the panel. Do you think with the number of people coming in such large numbers, domestic flights, resuming, do you think there will be a point? The same question I had asked the DGP. Do you think there will be a point where your quarantine facilities, accommodation will just exhaust, and then what happens?
You will have to give me time to make you understand the way we are operating. To start with, as I said in the beginning, we only had this road, people coming via road journey, either via the Dhubri sector or via the Sirampur Kokrajhar sector. So we started with one center in Sarusojai in Guwahati. It was a large facility. See, when people come, you have to screen them. You have to take their swab, and thereafter you have to provide some quarantine facility, either in budget hotels or paid hotels or our government constructed quarantine facility.
Right.
So it's quite a massive affair. It is not a very simple affair. People come, you will have to escort them right from the border, and thereafter they will come to one zonal center. Sarusojai was one. Gradually we made 5 centers. I'll come to it later.
Yeah.
So what happens in a zonal center, or for that matter in a district center, you must understand this. So people come, they queue, and thereafter all kind of registration takes place, and thereafter their details are captured, and thereafter based on what we call SRF, we also take their swab. That is collected, and thereafter there is a separate desk which allocates the accommodation for the institutional quarantine. Thereafter another fleet of vehicles there, they take them to different places, either in hotels or quarantine facilities. So it takes time, in fact. So we started with one, and then we made Sonitpur, that is Tezpur, for North Assam zone, for Jorhat for Upper Assam zone, Kachar of course for Silchar for Barak Valley, and of course Kokrajhar became another center. So now what we are doing is that we trained our district teams, and we have been able to increase in fact the number of such zonal facilities, even the district facilities. But now coming to a question about whether it will exhaust or not.
Yeah.
What we have done is that we have identified whole range of accommodation. We started with budget hotels. As I told that we cannot allow sharing of toilets. So that is a very key to stopping spread of COVID in quarantine centers. So thereafter going forward, obviously. So what is important, if number of people start coming now by trains or by air connectivity, in fact air passengers been coming, what is important is that people are put in quarantine, institutional quarantine, and they are released for home quarantine in a very speedy way. So
okay, that is the catch. A lot of seats, a lot of accommodations are getting vacated.
Yes.
Okay. The moment they test negative, you send them home.
Yes. In fact, the general SOP is that the moment SOP, in fact, swab is taken, and we keep them till the time we get the test results.
Right.
So enhancing our own capability of the labs and the turnaround time, the results time, this is also very important. Here I would like to say one thing. In fact, we started with zero. In fact, there was a time till March when all the samples used to go to Pune, NIV Pune, and thereafter Honorable Health Minister has been taking every day he reviews this particular aspect. Now we have 7 labs which are up and functional.
Testing.
Testing
the
centers.
Testing centers.
And
I understand even some private facilities are also collecting the swabs.
Yes. Based on open competitive bidding, we have impaneled some private labs also, just to enhance our capability of testing, because testing will going forward will hold the key for, so that a better, in fact, the turnaround time, faster delivery, and thereafter you are based on negative results, you are releasing people from institutional.
So that is the key.
Yes.
We will continue with this. We will continue with this. So you have a full strategy in place, and the way how you are having accommodation for so many people to quarantine them is because you are speedily releasing people after quick tests. So that is what the Assam health authorities are doing. But I am also being now joined by political analyst Mr. Swapnanil Barua. Swapnanil, I am just coming to you in a bit. Dr. Nivedita Bhattakur, yes, testing holds the key. Private labs are also testing the thing, but at the end of the day, you need exclusive COVID hospitals also, and that is also, I mean, putting a lot of pressure on the normal health infrastructure in the state. I mean, people who are having different kind of ailments. Not everybody is suffering from COVID, or not everybody is likely to suffer from COVID. But the medical fraternity is getting a little panicky. Private hospitals, there are cases coming to the fore. A person who goes to a certain hospital in Guwahati which later turned out to be a heart attack, and the person has eventually died. And the emergency says that, first of all, I want a COVID test report. So these are also emerging. Nivedita, what do you have to say?
Yes, absolutely. I think first of all, I'd like to say that there has been a strategy for almost every aspect that we could cover or humanly think of. And one of the first things that the government of Assam made a decision on was to open up the AAA Atal Amrit Abhiyan and the PMJY for all kinds of diseases. So that allowed many people to access private hospitals when, for example, GMCH was made exclusively COVID.
Yeah,
So
that
that
is
was one of
true.
the
But
things.
when what I'm saying is, when a person with a heart attack goes to a private hospital, I know of the case. I'm not going to name.
Yes, I
So that
understand that,
person
yeah.
at the emergency said, "Nani, you first come with a COVID test report. We will only examine after that."
So I think there needs to be some sort of a SOP in place, which I think the government has already started engaging with a lot of private providers, and also private providers have to be training their people, have to be talking to their people as to how to assess patients. Diseases will continue.
But you admit that that is a genuine problem.
It is a problem, of course. It is a problem.
So from being a professional medical practitioner yourself, Dr. Madhumita, how will you deal? How will you respond to such cases which is emerging, because that is also causing a lot of anxiety among the general population. People are saying that, oh, I wish nobody falls sick at this time. We will definitely going to die, especially people who have aged family members with them. They are extremely worried a lot.
That's, of course, a issue that's emerging, and we amongst us, we've been discussing about non-COVID mortality and morbidity during this COVID season. Most of the people who come to the hospital, at least I can tell you about the Guwahati Medical College, what we do, when we have a suspicion of COVID, we have a special ward where we put the patients into isolation pending the reports. We don't put all patients there. And those who we think are definitely not looking like a clinically COVID patient go into the general wards as usual. We are attending to them. We do have over 100 patients admitted under the medicine ward as of today. But I just want to add one thing, that there are some unusual presentations. For example, a patient of jaundice proved to be COVID. A patient of CVA proved to be COVID.
That can happen.
Yeah, that is the reason why maybe the private sector doctors are very worried, and they want to make sure that a COVID test is done before they go.
Okay, but that is easier said than done. You cannot get a COVID test until about at least 24 to 36 hours.
No, it's not that, Wasbir.
But but it's not easier said than done to get a COVID test. I'll come to Mr. Samir Sinha's views. But Mr. Swapnalil Barua, as a citizen, you have heard what we have been discussing in the studios, but as a citizen, this is also an aspect which is challenging, isn't it? In these times, everybody is not only suffering from COVID or apprehensive about COVID.
I think the situation being very fluid, it is. The knowledge about the disease has to spread much more wider. See, if someone is coming with a heart attack and that same person is also suffering from COVID, I think the treatment of the heart attack would take primacy, because it is an immediate nature of the thing, and COVID definitely, even in spite of its emergent nature of disease or infection or the treatment that is required, can definitely give you a certain amount of leeway. Now, as I was listening to a program on this COVID thing, and they were saying that this is the first time in the world where the medical fraternity is approaching the disease with a well-known idea about the genetic structure of the COVID virus, and also a broad framework of how to go ahead with the treatment of the disease. So this has not happened even in a very recent cases of SARS and other thing, and not to talk about the Spanish flu epidemic or endemic, which had happened long time ago.
Right.
So I think the education of the doctors themselves, and also the preparedness of the private sector hospitals which are taking care that any person can be suffering from two diseases together.
Okay, that is an important point.
And you must have a contingency in your hospital.
Right. I'll come back to you. Mr. Samir Sinha, the preparedness of the private hospitals. Is the government in touch with the private hospitals? I'm not talking about 2 months ago when you had that meeting with the private hospitals and you took them on board. That's a different story now. Now, state government and the health authorities have a fair idea as to how to deal with COVID. There is no panic whatsoever among especially dedicated people dealing with COVID in MMC, Mahendra Chaudhary Hospital, the Guwahati Medical College, or other exclusive COVID facilities. People are working with a lot of confidence, the medical fraternity. But what about the private sector hospitals dealing with normal, regular other ailments? Is the government in the meantime in touch with them?
Yes. We keep meeting. In fact, what Dr. Nivedita just told, that during this time, in order to facilitate patients of other diseases other than COVID, we had entered into an MOU. That MOU is still continuing with the private sector providers. Coming to the basic issue of COVID and a heart attack, COVID plus other disease. The protocol for government hospitals very clear, and in fact we have been hand-holding some of the private hospitals also who are in touch. The protocol is that you do a basic screening. All symptomatic and asymptomatic people can be segregated, and in case of required basic test. In fact, the COVID test can actually, RT-PCR test can actually be conducted before you go on to treat the patient in case if there is. So, because
can the private hospitals also do that?
Yes, why
How?
not?
But for the test, they have to send it to the government facilities.
Yes, obviously, because
and how long will it take?
It depends on the number of samples for that particular day. All the labs, Wasbir, I must tell you that all the labs are working overtime. There is hardly a day or night when they are not working. All of them, in fact, you start and I get calls at 2 o'clock in the night, at 4 o'clock in the morning I get some results. So in all the microbiologists, they are doing a yeoman kind of, in fact, Honorable Health Minister has also publicly, in fact, praised in his press conference yesterday. So idea is that whenever we get some samples from private hospitals, we try to expedite. And same is the case when we are our own doctors. Suppose medicine department, or for that matter any other department, they get some patient who are symptomatic and who need to be tested for COVID immediately. Obviously, that will be put on priority. But otherwise, the turnaround time.
Okay, let me ask you another question. Earlier, when that initially started, I'm talking about Assam. Suppose somebody is having a flu and I'm so worried that let me go and have a COVID test done. So that was not permissible unless you were symptomatic. It was not allowed. What is the case today? What is the situation today? Suppose anybody who is having some anxiety, I might be having COVID, so let me go and test. Can anyone go and do that?
Not without prescription. ICMR guidelines that we follow are very clear that only when you are having symptoms should you be tested for COVID. There are reasons. One reason that I get to feel is very clear, that because of the limited testing facility initially, of course, it is expanding, and fortunately for all of us, expanding very fast. That is the case, that if all symptomatic patients should be tested for, but about asymptomatic patient, in fact, it depends on the recommendation of the doctors, attending doctors, that who will opine whether to go for a test or not.
Okay. Now, Dr. Nivedita, apparently it takes only 3,000 rupees to get in the private sector to get a COVID test done, roughly about 3,000 rupees. A lot of people would be willing to pay 3,000 rupees to get themselves tested. So what does this mean? Do you think there is a need for the private sector to come up with testing infrastructure sooner than later, or is it already happening, or do you think the government has to get involved in even that?
As we already mentioned in this program, government is getting into some MOUs and some understandings with private laboratories already.
I'm asking about testing.
Yes, I'm talking about testing.
Okay.
Even for testing, they're going for it. Government of India and even Government of Assam is slowly coming to that position. But you have to understand, it's a very specialist test. Right from taking the swab, how the swab is taken, there can be false negative, false positive, anything is possible. So we have to go for it very carefully. It's not just, drawing some blood and doing some blood count test. So I think this is a step that has to be taken with consideration with testing. I mean, there is a reason why Pune was the only facility available for us. So there is a reason behind it, and we don't want to spread panic. I don't think the government wants to spread panic. We want to go about it in a reasonable way, and I'm sure when the right time comes, it will be done.
What about, Dr. Madhumita, what about rapid testing? Why, same question I will go to Samir Sinha also. What about rapid testing? It has been 4 months since December when it first started in Wuhan to now, December, it's almost 5 months that the world has been having COVID. Now, what about rapid testing? Why is it not the popular mode of tests?
First of all, the rapid testing, the method basically detects the antibody that a person who's been who develops after having been infected with the COVID virus. And it's of two types, the IgM and the IgG. The IgM comes into the body within 5th to 7th day of the infection. So you have a high probability of missing the infection if you do not do it at the right time. And the IgG is what develops later on and gives you some kind of immunity against the infection. Till date, nobody knows how long the IgG is going to last, and the idea of the vaccine is the IgG. So it's the timing, exact timing, which will tell us whether you have done it at the right time for having picked up or missed a disease.
Okay. So basically what you were saying is that, you know, it is not completely reliable. So the benchmarks are not yet set for the rapid test. Perhaps that is the reason in layman's.
There are limitations.
There are limitations in the test. Before I ask Mr. Samisina to wrap up, Mr. Swapnanil Barua, you know, we are racing towards 700 mark in the next couple of days. Assam may have 1,000 cases, but you know, I think the silver lining is that all these people in the last couple of days are people who have come from outside, having a travel history, and people in quarantine. So quarantine holds the key, isn't it? And so people have to understand these facts.
Yes, definitely. Quarantine holds the key, whatever it is, whether it's institutional or the people take it upon themselves to do home quarantine. Quarantine is a must because the disease has a spread till it can show itself, and that period definitely has to be gone through. But I think I must congratulate the government of Assam, especially the health department, at the rapid rate of increasing of the testing capacity. And I believe I would request them to kindly extend it and make it mandatory on the private hospitals also to have this kind of testing facility as a part of their standard equipment while giving a license for a private hospital to operate. Because what will happen
that
is
will
that
perhaps happen in the coming.
COVID is going to stay with us for a
Right. That may perhaps happen in the days ahead.
The government themselves have, government themselves have shown the way that it can happen so fast. I mean, increasing the testing capacity. So I don't understand or don't believe that it will not be equally possible on part of the private hospitals also to install this testing facility.
Right.
In that short possible time. If the
Right.
government can do it,
Absolutely,
they can also do it.
absolutely. I am in the last few minutes of the show. Mr. Samisena, you know, a lot of people want to know. I'd like to take the opportunity of your presence on the program. That why is it that so many people coming from outside are testing positive? Why? Is it because they stayed unsafe during the last 2 months that they were wherever they were? Or do you think the overcrowding in the trains, lack of social distancing in the, other modes of transport that they had taken to reach home? Do you think these are some of the reasons? What has been your assessment? You must have gone into some details on this.
You said it actually. All these factors that you mentioned. Let us remember, I'm not a technical person, but it's a very, very highly contagious, in fact, spread, this virus. More contagious than any other virus that under SARS or Ebola or whatever we had. It's very, very contagious. So people traveling together, people staying together, and coming from all these cases. In fact, 80 to 90% people who have come to the state of Assam, as I said, that they have come from what we call red zones. They are coming from Maharashtra, they are coming from Kerala, they are coming from all kind of southern states where it is kind of raising this. But only that is why most of the travel, most of the people who have come so far, they have come through by the road route. Where they are kind of common passengers coming, and in fact even one person is positive, obviously the rest, some of them will actually get infected. So only issue is that 80% cases are mild to moderate cases. We were talking about hospital facilities and quarantine facilities, and I was talking about medical, in fact district hospitals going below also to subdivisional level or maybe the CHC level. So mild and moderate cases, it is possible that somebody who is positive and will not show any symptom unless tested, he or she may not, in fact it will not show also. So one has to be very, very careful. You just mentioned about social distancing, taking all kinds of, and here special precautions need to be taken for the elderly.
Absolutely.
Yes, elderly.
Absolutely.
And
Special
also,
care.
also the pregnant women, the Divyang, our people with all kinds of,
Absolutely.
comorbidity, the young children, they need to be protected.
Young,
And
absolutely young children
Yes.
and those elderly needs to be
Yes,
protected.
protected.
Nivedita, I mean, we have to be careful, but there is no need to panic. Will that be your final words?
Absolutely. As I said at the beginning, we have to learn to live with COVID with all precautions. I think that's my sort of, we have to deal with it.
Absolutely. Madhumita, learn to live with COVID,
Yes.
the new normal.
Yeah, that's the new normal. We'll learn to not shake hands anymore. We'll learn to maintain a social distance. We'll learn to be using the mask. That's going to be a part of our normal attire. We'll be leaving our shoes outside. If we make it a part of our normal life, we're going to learn to live with COVID. That's
Learn
going
to live with
us.
COVID. Swapnanil Barwa, unfortunately, I could not engage you very much today in the discussion. Yes, Samir Sinha, making a last point.
No, maintain safe distance from the elderly. That is.
Protect the
young
pediatric
population.
and the geriatric.
Yes, this is very,
and
very
the
important.
comorbidities.
Okay, these are the three. Leave out the pediatrics, the geriatrics, and the comorbid people with comorbidity. So we have had a very, very enlightening discussion on this emerging situation. Assam is on the road to touch about 1,000 cases in the next couple of days. But the silver lining is that things seems to be not gone out of hand yet, and that is because the Assam health authorities have been making preparations to deal with just this even before the COVID had come to the state. But yes, we have to be ready to continue with our battle with the disease. Be careful, but don't panic. That is the last word. Of course, we'll be debating on this issue in the days ahead. And I would thank all my panelists for participating in the show and the viewers for watching the program. Good night and goodbye.
Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons, and Pius Group of Institution, Guwahati.